Imagine waking up with a broken bone. No hospital, no painkillers, no doctor, just you, the cold ground, and a tribe that needs you to survive. This was everyday life 40,000 years ago. And yet, ancient humans didn't just die from every cut and fever. They survived, they healed, they developed medical knowledge so advanced that some of it still works today. How did they do it? The answer will completely change how you think about ancient people. They knew plants better than we know drugs. Modern medicine didn't invent healing, it inherited it. Ancient humans spent hundreds of thousands of years learning which plants stopped bleeding, which reduced fever, which killed infection. This wasn't guesswork, it was science. Slow, careful, generational science. Willow bark. You've probably taken aspirin today. Aspirin's active ingredient, salicylic acid, comes from willow bark. Ancient humans were chewing willow bark to reduce pain and fever 40,000 years ago. Yarrow. Found in prehistoric burial sites across Europe and the Middle East. It stops bleeding almost instantly when pressed into a wound. Ancient hunters carried it the way soldiers carry bandages today. Echinacea. Native American tribes used it for infections, snake bites, and immune support. Modern research confirms it works. Turmeric. Used in ancient India and Africa for wound healing and inflammation. Hospitals now study it as an anti-inflammatory compound. These weren't random discoveries. Ancient healers, shamans, medicine women, tribal elders spent their entire lives testing, observing, and teaching. When something worked, it was memorized and passed down. Surgery without hospitals. Here's what most people don't know about ancient humans. They performed surgery. Real surgery. Archaeologists have found skulls from 10,000 years ago with holes deliberately drilled into them. This procedure is called trepanation. And here's the shocking part. Many of those skulls show signs of bone regrowth, which means the patient survived. They weren't just cutting people open randomly. They were relieving pressure from head injuries, treating severe headaches, possibly treating what we'd call seizures, with stone tools. No anesthesia, no sterile environment. And people survived. We've also found ancient skeletons with healed broken bones that were clearly set by someone. The bones aligned too perfectly to have healed on their own. Someone knew how to set a fracture. We've found evidence of amputations. A 31,000-year-old skeleton in Borneo had its lower leg deliberately removed, and the bone had healed cleanly. That person lived for years after the operation. Ancient humans were performing successful amputations 31,000 years ago. Bone tools and natural anesthesia surgery is one thing, but how did ancient humans handle pain? They couldn't just endure it. Extreme pain causes shock. Shock kills. Ancient healers knew they had to manage pain, or their patients would die on the operating table. So they found ways. Alcohol. Fermented drinks existed long before civilization. Ancient healers used them to dull pain before procedures. It wasn't perfect, but it worked well enough. Certain mushrooms and plants contain natural compounds that cause drowsiness, numbness, or altered states. Healers knew which ones. They used them carefully in controlled doses to sedate patients during painful procedures. Pressure points. Some ancient traditions discovered that pressing specific points on the body reduces pain in other areas. This is the foundation of acupuncture, a practice over 3,000 years old. And cold. Ice and cold water numb tissue. Ancient humans living near frozen rivers knew that placing snow on a wound before cutting reduced the pain dramatically. They had a complete toolkit. Not modern anesthesia, but functional, effective enough to perform trepanation, effective enough to amputate a leg, effective enough to keep patients alive. How they diagnosed illness. Without blood tests or x-rays, ancient healers had to read the body. They watched the color of skin, yellow skin, liver problems, pale skin, blood loss or anemia, flushed red skin, infection or fever. They smelled breath. Sweet-smelling breath meant something wrong with blood sugar. Rotten breath meant tooth decay or gut infection. Ancient healers used smell as a diagnostic tool the way modern doctors use machines. They watched urine, color, smell, consistency. All gave information about what was happening inside the body. This practice survived all the way into medieval European medicine. They pressed on the body. Pain when pressing certain areas told them which organ was affected. Ancient healers built detailed mental maps of the body's interior without ever seeing inside it. This wasn't primitive guessing, it was systematic observation built over thousands of years. Many of these diagnostic methods are still used today as a first check before the machines take over. Childbirth and women's medicine, one area where ancient medical knowledge was especially advanced. Childbirth. In a world without hospitals, childbirth was the most dangerous medical event a person could face. Ancient tribes knew this. They developed entire systems around it. Midwives, women who specialized in childbirth, existed in every ancient culture we've studied. They knew which plants helped labor progress, which positions reduced complications, how to turn a breech baby, how to stop postpartum bleeding. The knowledge these women carried was extraordinary. In some ancient communities, maternal death rates were lower than in 19th century European hospitals because those hospitals didn't understand hygiene yet. Ancient midwives washed their hands, not because they knew about germs, because they had learned through generations of observation that clean hands meant fewer mothers died. They figured out sterile technique thousands of years before Pasteur. The healer's role in the tribe. In every ancient tribe, there was a healer, not a warrior, not a hunter, a healer. This person's job was medicine full-time. They collected plants, they treated wounds, they learned from experience. They taught the next generation. This is how medical knowledge survived for thousands of years before writing was invented. Not books, not schools. One healer teaching the next. The healer was often the most protected member of the tribe, because losing them meant losing all accumulated medical knowledge. One bad hunting accident, and everything they knew could disappear. This is why ancient medical knowledge was treated as sacred, wrapped in ritual, in ceremony, because ceremony made people remember it. The ritual wasn't superstition, it was memory technology. Infection was the real enemy. The biggest killer in the ancient world wasn't predators. It wasn't cold. It wasn't starvation. It was infection. A small cut that got infected could kill a healthy adult in days. Ancient humans knew this. They learned to clean wounds aggressively, with clean water, with plant extracts, with heat. Honey. Ancient healers across Africa, Egypt, and Asia used honey to treat wounds. We now know why. Honey is antimicrobial. It kills bacteria. They didn't know about bacteria, but they knew honey worked. Maggots. Some ancient tribes used maggots to clean infected wounds. This sounds horrifying, but maggots eat only dead tissue, not living tissue. Modern hospitals still use sterile maggots for exactly this purpose. Fire. Cauterization, burning a wound closed, was practiced for thousands of years. It stops bleeding and kills surface bacteria. It's brutal, but it works. Ancient healers didn't understand germ theory, but they understood cause and effect. This plant heals. That treatment kills infection. This method saves lives. What happened to this knowledge? Most of it was lost. When ancient tribes were destroyed by conquest, by disease, by migration, their healers died with them. Thousands of years of accumulated medical knowledge gone in a generation. We are still trying to recover it. Ethnobotanists travel the world's remaining indigenous communities documenting plant medicines. Pharmaceutical companies spend billions studying traditional remedies, looking for new drugs. Many of our most important medicines, aspirin, quinine, morphine, trace back to plants that ancient healers used thousands of years ago. The people we call primitive built a medical system that kept humanity alive through ice ages, migrations, predators, and pandemics. Without hospitals, without laboratories, without any of the tools we consider essential. They survived because they paid attention. They observed. They shared knowledge. They protected their healers. Next time you take medicine, remember, someone 40,000 years ago figured out the first version of it. Standing in a forest, watching the world, trying to keep their tribe alive, and they succeeded.